Hi, I'm Brenda, and welcome to the Umbrella of Theory. This is for MOT 502, Applied Occupational Theory, and we are going to make your very own study sheet. It's going to look like this. I know you can't see it, but that's okay. So grab a piece of paper, maybe some colored pens and pencils, and we're going to talk about theory, organization, and occupational therapy. Now, the first thing I want to say is that occupational therapists organize things in different ways. They organize theories in different ways. We're using a very, very commonly known way of organizing theory that includes paradigm, occupation-based models, and frames of reference. However, you might hear telescope, toolbox, and file cabinet. You might hear someone talk about organizing models of practice and functional models of practice. So there are different ways of talking about theory. So if you talk to someone who's from another school, you might get a different take on how theory is organized. But we use this across the board in University of Indianapolis Occupational Therapy Program to organize theory. All the professors know this, and so they'll talk about for each, like in process class, you'll have to find an occupation-based model and a frame of reference to go with a particular case study, let's say for your competencies. That's one of the reasons why you need to save the textbook and you need to save some of your study information from this class. It'll be really useful later on. So let's get to it. So first of all, we have the top of the umbrella. This is going to be our paradigm. Let's make that a little darker. When we're talking about theory organization, what do we mean when we say paradigm? Well, what we mean is sort of the bird's eye view, the overarching view of what goes into the theory of occupational therapy. And believe it or not, you already know a good bit of this. Some of it you had when you had your prerequisites. So you had biological sciences, or bio, okay? You also had psych. You also had some soc. All those concepts go into the concept of occupational therapy. We also have the idea of medicine, and the idea of kinesiology, how people move. Those are some of the prerequisites or the overarching ideas that go into the field of occupational therapy. But you also know some things about occupational therapy, some paradigms of occupational therapy that you've had in other classes. One of them is the OT practice framework, OTPF. OTPF has tons and tons of theory in it. And as we get into this class, you're going to be going, oh my gosh, I already learned about that when I learned about the OT practice framework. Many of our occupation-based models are pulled into the OT practice framework. And it gives us sort of that overarching bird's eye view of what goes into occupational therapy. Not necessarily for a particular client, but just the idea of why it is we have an entire profession centering around occupation, why we think it's so important that we're going to focus on the idea of occupation. That's what goes into that paradigm. That's what the OT practice framework is all about. We also have our code of ethics and core values. That document, so core values, code of ethics, that document talks about what's important to occupational therapists, what we believe in, what are some of the ways that we think occupational therapists should behave and should treat people with respect. That's part of our paradigm. It's the broad idea. Doesn't tell us specifically how are we going to treat a particular person to get them better, but it does tell us something about the idea of how we treat people in general. So we also have our philosophy, our standards of practice, and our standards of continuing competence. Now I want to come back to philosophy for just a little bit. What is the grand idea of occupational therapy? What's our core philosophy? Well, it's occupation, right? So if it has occupation in it, it's going to be part of our paradigm. as occupational therapists. So that's our first level of theory, paradigm. That's the big umbrella view. Let's talk about occupation-based models now. So we're going to make the bottom of the umbrella, and I'm just choosing a different color to do that. All right. So underneath this umbrella, things that go under it, occupation-based model. I'm going to make this in a little darker color here. Occupation-based models. Now, you've probably already run across some of these in therapeutic skills or in some of your other classes. Probably you had a little introduction to this in issues 1. So some of our occupation-based models, model of human occupation, MOHO. That's Gary Kielhoffner's, right? If you go to the theory tour, you're going to get a little bit of an overview of each of these. I'm just going to put down some examples, not all of them that we're going to be studying this semester. CMOP, Canadian Model of Occupational Performance. PEOP, and OA. Okay? So let's go through these just a little bit. MOHO, Model of Human Occupation, written by Gary Kielhoffner and others, but Kielhoffner's the main one. What are some of the main ideas behind MOHO? What do you remember from MOHO that sets it apart from other occupation-based models? Okay, so you might think about the volition, habituation, performance capacity, those 3 subsystems of the person. You might think of the open system. That's all MOHO. CMOP, Canadian Model of Occupational Performance. Who wrote that? Well, that would be the Canadian Occupational Therapy Association, or the Canadian Association of Occupational Therapists. CAOT is who wrote that. PEOP, Person, Environment, Occupation, Performance. That was Christensen and Baum, both American occupational therapists. And Baum. OA stands for Occupational Adaptation, and that would be Schade and Schultz. Schade is S-C-H-K-A-D-E, Schultz S-C-H-U-L-T-Z. Okay? CMOP sets itself apart because of the human spirit at the center. PEOP because it looks at occupational performance. Occupational adaptation focuses on the adaptive process. But what do all these have in common? What is an occupation-based model at its heart? How are all these similar? Well, an occupation-based model, first of all, the word model kind of tips us off. It usually has a visual component, something that we can see that helps us organize the concepts and sets out principles for change for individuals. Organize the concepts, sets out principles for change, and shows the relationships between those concepts. So when you look at, like the CMOP, and you see this sort of circle inside of a triangle inside of another circle, it's showing you how the concepts are internested and how they are related to each other by the visual model. Another thing all the models have in common, besides having a visual model, is that they have 3 principles or 3 ideas in common for any occupation-based model. And if it doesn't have these 3 things, it's not an occupation-based model. First of all, it has occupation in it. If it's not written by occupational therapists for occupational therapists, it's probably not an occupation-based model. Secondly, it focuses on the person. So whereas a paradigm sort of looks at the general ideas of occupation, an occupation-based model looks at how are we going to interact with a particular client. Usually an individual, usually a person, sometimes a group, sometimes an organization. But it focuses on the person, the occupation, and can you think of the third one? It's going to be the environment. So it's actually spelled out in the PEOP, person, environment, occupation, and then that one adds on occupational performance as well. All these different occupation-based models, as well as the others that we're going to learn this semester, have those 3 concepts in them. And that's what makes up occupation-based models. Okay, But what about some of those other concepts that we know about? What about biomechanics? What about neuroscience? What about cognitive interventions? Where do we get theories that help us with those? Well, we need a handle on our umbrella, right? Our handle is our frame of reference. Frame of reference. Now, if a paradigm is the overarching view, considering occupation and the importance of occupation in the world in general, if our occupation-based models are visual models that help us define the concepts and the principles and how they relate to each other in terms of person, environment, and occupation, then our frames of reference are going to be practice guidelines in specific domains. Practice guidelines in specific domains. Very important to remember. So that's how we're differentiating paradigm, occupation-based models, and frames of reference. Can a frame of reference not have occupation in it? Yes, absolutely. Can a frame of reference be used by other professions beside occupational therapy? Yes, absolutely. Okay? When it comes to like model of human occupation, occupational adaptation, those are pretty much used exclusively by occupational therapists. Frames of reference might be specific to occupational therapy, but they also might be used more broadly, used by other professions as well. So for example, we have biomechanics. Which you get several semesters using that frame of reference. We have neuroscience. I'll shorten it to neuro. Okay, which you get one semester in neuro. So there are some frames of reference because of the detail involved that we have to give more time to in our field. But we also have the intentional relationship model. That's one that we're not even covering this semester because, again, with therapeutic skills, you have an entire semester that covers that particular frame of reference. We have sensory integration. That one's exclusive to OT. Well, it was developed exclusively for OTs. It gets used by other people now too. Sensory integration. That's another example. Cognitive disability. Allen's cognitive model. So these are some examples of frames of reference. Definitely not all-inclusive here. We're just giving some examples as we build our model of how it is that we organize theory in occupational therapy. We're going to have a ton more under here, and there are tons more that we're not even covering this semester that you'll find out about in your career as you go along. You'll find a new practice technique, a new way of looking at something. And they may not come out and say, oh, look, it's a frame of reference. But guess what? It is a frame of reference. This is just simply the way we organize how we think about what these theories are. And one of the things that this does when we set aside certain kinds of theories as frames of reference is it lets us know that, A, these may or may not be exclusively used by occupational therapists, and B, they're for specific domains. So for example, if I break my finger, I definitely want my therapist to be using a biomechanical approach, not necessarily a neuroscience or a sensory integration approach. It's a practice guideline for a specific domain, perhaps a specific patient population, perhaps a specific disorder, perhaps a specific issue that a person is having, like a psychological issue. Or a mental health issue. So there are a number of different frames of reference that we'll be talking about this semester. So theory in general tells us why. So the whole thing, theories tell us why. Okay? It validates and guides us as OTs. And I've done this. I've had a physician come to me and say, why are you using this particular test for this particular individual? That doesn't make any sense to me. And so I go back to the literature. That's where my evidence comes in. And it's a neurological theory behind what it is I'm doing. And so I can validate myself to that physician and say, this is why I selected what I did. Here's my rationale. Here's the evidence for that rationale. Theory helps us validate ourselves, and it gives us words in order to do that, so we don't have to go, I don't know, I thought it was a good idea. It's much more rooted in the evidence than that. It can also justify reimbursement. It's awfully nice when you have a payor asking you questions where you can say, well, here's why. This is why I do what I do. So justifies reimbursement. Okay, and it clarifies specialization. So, if I want to become a sensory integration specialist, I can look into that theory more. Okay, it also tells us about the profession's growth and development. So the profession's growth. So if you look, and we'll talk just, as we go along, a little bit about the history of each of these theories, and we'll see how the profession has grown over time in that way. It also helps us to educate future practitioners, of course, of which you are some. Educate future practitioners. All right. So that's why within the first semester we've got you guys learning the OT practice framework and the code of ethic and philosophy and standards of practice and continuing competence, because these theories help educate you about the whole idea of occupation. All right. Frames of reference in particular tell us how. Okay. So we have a lot of why when it comes to our paradigm and our occupation-based models, and you can even draw on some of the why from the frames of reference. The how, what exactly is it that we're going to do with a specific client to get them better, usually comes from a frame of reference. The occupation-based models are broader than that, and they might give us some broad ideas, and they might give us some assessment tools. But as far as like when I have my broken finger, how many exercises do I have to do, and what kind of a splint should I have, that's going to all come from the frame of reference. Gives us that how. So they're going to tell us about population. So it's going to define for us, kind of frame off, who we're going to use biomechanics with, okay? It's going to tell us about function to dysfunction. What's the definition for functional? What's the definition for dysfunctional? So function, dysfunction. So if you think about that, biomechanics, dysfunction is you can't move, function is you can. In sensory integration, it has more to do with how you take in sensory information and, to what degree that's a difficulty for you. It also tells us postulates for change. How do we get people from dysfunction to function? How do we move them through that progression? So it gives us change, principles for change. How do we get people to change? All right. It also tells us principles for what it is we're actually supposed to do, so treatment principles. Okay? It also tells me what my role is. Okay? So say in biomechanics, my role might be more educative and more, I'm more instructing the client, I'm providing them a splint, I'm more doing to them. Whereas in sensory integration, I might be doing more with them. And in cognitive disability, my role might be more of a coach, of helping the person come up with their own strategies for their cognitive disability. So there are going to be different ways that I behave depending on what frame of reference I'm using. So that's part of the how that comes with the frame of reference. All right. And then also, what are my tools? What are my assessment instruments? And so you probably have got some of these already. So like biomechanics, what are some of your tools? Goniometer, manual muscle test, palpation, right? Some things like that. Neuroscience, what are some of our tools? Well, they're going to be some of our techniques like task-oriented approach, things like that. Sensory integration, there's a whole lot more equipment. We've got swings and slides and things like that. And cognitive disability, maybe we're using technology. So different tools come into play depending on the frame of reference. Seems kind of obvious, but the idea of understanding what those tools are and what theory they come from, being able to draw those lines is really important so that we can provide that evidence. So, I believe that covers everything that I was going to talk about. This actually comes from your O'Brien and Hussey OT introduction book. They talk about this umbrella of theory. So that is my little reference for today. So I hope that this helps to give you an idea of how we're going to be organizing theory and that this will be useful to you. All right, looking forward to seeing you next week. Thanks.